Hello, I'm Dr. Bernadine Donahue. I'm a board-certified radiation oncologist here at Maimonides Cancer Center. I attended Boston University's 6-year medical program and graduated from that in 1984. And after that, I did my internal medicine residency training at Boston University Medical Center in Boston, and then completed my radiation oncology residency at New York University. And after that, I became faculty and staff at NYU. Was there for 15 years, and then came here to Maimonides Medical Center in 2005. So I became interested in radiation oncology really during my residency training because of my interest in oncology in general. That was the late 1970s, early 1980s. The war on cancer was in full force, and there was really a lot of excitement about the research and the developments in oncologic care. I also, though, was interested in the technological aspects that were being developed to treat patients with cancer. So radiation oncology was really the perfect marriage of the interest in the technology side of things and the oncology side of things. And that's really how I became interested in radiation oncology. And when I was a medicine resident, we spent a lot of time actually with our patients down in the radiation oncology area, actually transporting them and helping them get through treatment. So I got to see that end of things, and after that decided to pursue a career in radiation oncology. So within radiation oncology, we subspecialize, and I subspecialize in GI tumors, pediatric cancers, and brain tumors. I really came to my interest in brain tumors and pediatric tumors during my time at NYU. We had a very active neurosurgical service. NYU really took a lead in starting some of the intergroup studies for patients with brain tumors, and through that I became involved in something called the Radiation Therapy Oncology Group and the Children's Oncology Group, which are both NCI designated national cooperative groups that run trials to study patients with brain tumors and with pediatric tumors. So within those groups, most of my work is focused specifically on brain tumors, particularly pediatric brain tumors such as medulloblastomas. And I think it's really been through that work that I've become more and more interested in those particular tumor types. I think all of us at the Maimonides Cancer Center, whether it's the medical oncologists or the radiation oncologists, our nursing, our therapists, our psychosocial workers, our nutritionists, all of us really work together as a team. I think philosophically try to approach our patients not as a disease, but as a patient with a particular disease. And that's probably core to our philosophy at the Cancer Center. Diseases are something we can read about and study about and know the mechanisms of and try to learn the mechanisms of and know how to treat, but unless you put it in the context of that individual patient and really their whole medical history as well as their whole social history, I think we're really not fully addressing what the patient needs. I think our basic philosophy tries to deal holistically with the entire patient. So radiation oncology has been immensely impacted really by the growth in computer technology and imaging that we've seen over the past 15 to 20 years, but even over the past 5 years, there's been an explosion. When I started in radiation oncology, we literally designed radiation portals by taking a piece of film and drawing on the film with a China marker, or literally drawing on the patient's body and outlining anatomically based upon what we knew from anatomy what needed to be treated. It's a vastly different world now. We're really guided by things such as MRI, PET scans, CAT scans, the ability to fuse all the diagnostic images to help us target tumors, and the ability to actually deliver the tumor that we now see on images. All of that's really been driven by the advances in computer technology as well as imaging, so it's a vastly different world than what it was 20 years ago. I think there's recently been a huge emphasis on radiation safety and the delivery of radiation in a safe manner, and that's something that's also quite an interest of ours at the Cancer Center in terms of quality assurance programs, and I think that's something that computer technology has aided us vastly in as well. Absolutely, the clinical breakthroughs in the past 5 to 10 years in molecular targeting of agents, as well as targeting of agents with images, has made a huge difference in our field. I think the field of cancer medicine in general is moving towards personalized medicine. All tumors are not the same in all patients, and we're learning on a molecular level how to identify what exactly are the mechanisms that turn on a patient's tumor. And it's never one mechanism, it's usually more than one. And if we can identify those mechanisms, we can target them. So I think the whole field has moved towards an individualized medicine approach. I think we would want new patients who come to the Maimonides Cancer Center to know that we philosophically very much believe in the team approach to a patient. We try to approach patients as people, not just diseases. They're persons who are afflicted by a particular disease. They are not the disease. The team approach really allows us to meet as a group, whether it's surgeons, radiation oncologists, medical oncologists. There's really no such thing as operating in a vacuum anymore. We really want to give our patients the breadth of knowledge from all the subspecialties that are encompassed by the Maimonides Cancer Center. So patients' cases are presented prospectively at tumor boards where we really get the input from every specialist to try to come up with what we think is the best recommendation for the patients. And it's not just whether it's a surgeon or a medical oncologist or a radiation oncologist who may be the primary physician for the patient, but we really incorporate everyone's opinions in the decision-making process. And the other team members are included as well, nutritionists, the psychologists, the social workers, to really try to have input to the patient, again, as a whole, not as a disease. I think that probably something that's key for me really on a daily basis, or perhaps inspirational to me on a daily basis, is we see our patients who are facing life-threatening illnesses, and they get up every day, they go through the day, they do what they have to do. I think that's the biggest achievement, that we're allowed to help patients do that, and that's really, I think what our jobs are all about.